Welcome, everyone. Thank you for joining us. Our webinar today is entitled GI Effects in Clinical Practice, focusing on the gut. Our guest speaker is Dr. Rebecca Hunton. My name is Lahnor Powell. I am a medical education specialist in Genova's Atlanta branch. I am going to serve as the moderator for today's webinar. We would like to welcome Dr. Rebecca Hunton. Dr. Hunton earned her undergraduate degree from the University of Florida and completed her medical training at The Ohio State University. A practicing physician, Dr. Hunter is the founder of RHMD LLC, an integrative functional medicine practice where she helps her clients become radiantly healthy. In 2017, the RH6 was launched, offering vitamin infusion protocols to the public. She is board certified in family medicine. Additional fellowship training and board certifications include American Board of Integrative Health and Medicine, American Board of Anti-Aging and Regenerative Medicine, American Board of Obesity Medicine, American Board of Hospice and Palliative Medicine, and more. Along with these board certifications, she currently has faculty appointments at George Washington University Department of Integrative Medicine, along with University of Miami's prestigious iCamp series. Dr. Hunton brings other unique credentials. She is a preferred provider for GOT Pro Health, an organization sponsored by the NFL Football Association and NBA leagues, and has additional expertise on nutritional support for competitive athletes. Dr. Hunton has been a featured speaker in many venues, both to professional audiences and the general public. Finally, as a member of the selective TED Active 2013 and TED Med 2016 communities, Dr. Hunton is an advocate for changing healthcare and wellness worldwide. Before we begin, I'd like to encourage all of our participants to let us know of any clinical questions or technical issues that you may have throughout the webinar. Please type these questions or concerns into either the chat or questions box. Make sure to send them to the organizer at any time during the webinar. We will try to assist with any technical issues as they arrive, and we will be compiling your clinical questions and answering as many as we can in the final 15 minutes. One of the most common questions asked during the webinar is about the availability of the presentation and the slide deck. These materials will be available on our website within a week of the webinar. If you are interested in having these resources, please click the Clinicians tab on the home page, where you will find access to our webinars under Medical Education. Or you can also log into My GDX account to find these webinars. And if you don't have a My GDX account, please click on the Getting Started link on our homepage and follow the instructions to set up an account. Now I'm going to turn over the role of presenter to Dr. Hunton. Perfect.
All right.
You can see your screen.
Welcome. Okay, welcome everybody. If you've listened to my presentations before, you know I always include a little bit about, about the business and how to actually do it in the practice as we go along. But my objective is to discuss some novel patient populations where GI effects test may be indicated, how we use it in our office flow, to look at some recent published studies, some of which were presented at the recent IFM in LA, and the use of GI effects to help that population, and then a couple of really interesting case studies to show how we used it in practice and actually how the patient's outcomes changed because we used the GI effects testing. So in our office, as a new patient comes in, we have these buckets, and the engineer one at the bottom is kind of tongue-in-cheek, but we kind of take the patients in and we kind of categorize why they're coming in and what they're coming in for. And by doing this characterization, it kind of puts us on a certain clinical path of where we start with most of these. And so when I look at the ones now highlighted in red, almost all of these patients, we're going to start by looking at the gut. There may be some other clinical lab work we might draw, but the majority of the new patient follow-up and where we're going to dig first is going to be looking at the GI effects test. Then for the next group, we're going to probably maybe not start there, but it is oftentimes our second step after we're looking at some other things. The thyroid hormones, we definitely get there at some point, but and I'm going to put autoimmune thyroid up in the autoimmune category, but it is not something we start with or is our next step. So if you can see in all the buckets of people that we have come into the practice, we're usually using the GI-FX test with either their first new patient visit or most commonly, or if not then, the second patient visit that they're coming in looking at why they are feeling the way they are. So the first response, and it's, I don't know about your patient populations. Most of mine, they're just now like putting their toe into functional integrative medicine. Every once in a while, we'll get the very sophisticated patient who's been down this path before, but most of them, when I tell them we're going to start with the microbiome, and they'll say, well, I just had a colonoscopy, or, you know, oh, I did a stool test once and it was negative, and having to explain to them the why can be a little challenging. So I use some of my past experience to kind of play off of that. I talk to them about TED, and fortunately, most people today are familiar with TED. Back when I first did it, people would say, oh, you mean that movie with the bear? And I'd be like, no, no, no. TED Talks are, at the most, they're 18 minutes long. They're always entertaining, and they always use what's considered pretty good, solid, sound science. They, for example, there's no TED Talks about GMOs causing birth defects because we really don't have the studies. Though, you know, a lot of us might, by even common sense, agree that limiting exposure makes sense. But they do have quite a few talks on the microbiome and how it impacts health. So I have this templated into the plan that I give to the patient when we're doing this. It gives them the URLs for several of the TED Talks that they can look at. And sometimes I'll highlight one if it's more aimed at what they're doing. And I'll tell them you can get TED Talks on an app on your phone, through Netflix, online. And if you only have time to listen to one, I would start with this one. So for autoimmune disease, I'm often using the type 1 diabetes and the microbiome. There's also one Larry Smar did for TED Med, which is about inflammatory bowel disease. So pretty much anything that we're looking at and the reasons we're looking at it and the science we have for looking at it, there's a TED Talk which really puts it in lay language. And a lot of times this will persuade the patient to do the GI-FX test. We also charge in our office a kit fee. We didn't used to do that, but we started doing that. I think it's $20. And since we started doing that, we also have a lot more patients completing the test. It was one of those things where they would come back and say, yeah, I know you wanted me to do that, but now we definitely have much more buy-in since we started referring the patients to do the TED Talks and to charging the kit fees. The other thing I use, and I have these three and specifically bookmarked on my computer, is, and I'll turn my laptop around and show it to them. I have more than this, but this is three of the brief ones. And I'll say, well, you know, if you haven't read or been exposed to this, here's where Parkinson's disease may start in the gut, and this is why I want you to do this. And so these are more lay articles or snips of things that kind of give credence and persuasion to have them do the test. And I would suggest that, you know, if you use a computer, you do that. I have a colleague who doesn't have a computer, who just has these, you know, copied and stapled together and shows them to the patient in the room. Now, for our more sophisticated patients, I'll actually pull this up and kind of talk about how the microbiome triggers autoimmunity. This is relatively new, 2014. It's was in the Lupus magazine, and when they see it graphically, even if they're not really truly medical, you know, talking it through and saying, you know, all the things that we eat, the bacteria, the viruses, everything we inhale, our immune system's always constantly, you know, figuring out what's me, what's not me, what's, you know, a friend and what's a foe. And when that gets out of balance, it triggers our immune system in an unhealthy way. And that triggering can sometimes create antibodies to our cartilage, to our thyroid, and it brings some, again, some evidence and credence to why I'm starting with them collecting their poop instead of sending them to the traditional lab for a whole bunch of tests. This is another article that I'll pull out, or diagram for rheumatoid arthritis, and showing what a normal person does with those kinds of things and how it impacts and what happens when we have the dysbiosis and we get out of balance. I'm very big on educating the patient in the office. So some of you may have not even heard or been around lately some of the new ways we're using the microbiome. The neuroscience lectures that we had at IFM this summer, there were several talking about how Alzheimer's really is maybe caused by infections, and how the protein, the tau protein, is actually a response to kind of help protect the brain from the infection. Now, I know one of the big ones that they're talking about is HPV, and of course we're not really measuring viruses, or HSV, sorry, human simplex virus, not human papilloma, and we're not really measuring viruses, but it does help bring to bear that we really should be looking to see if lipopolysaccharides and some of these not so friendly bugs are showing up in both our bloodstream as well as in our gut. This is an article, I believe it was Dr. Perlmutter referred to it, and I chased it down. But the lipopolysaccharides levels in the brain were greater in Alzheimer's disease. And so it makes intuitive sense that if we can bring the microbiome back into a more holistic, normal pattern, that we would improve our chances of this type of thing happening in our future. Now, I also tell the patients, I'll say, this microbiome research, you know, it's exploding. There's articles published every day. I learn new things all the time about this. It's kind of like, you know, putting together a 10,000 piece puzzle. We've got most of the outsides and corners, and we might have a couple of clumps going on in the middle, but we don't have the entire puzzle put together yet. What we do have are some fundamental things that we can work with, but, you know, there's a chance that you might fall into one of those places where we don't have all the pieces, but at least, you know, this gives us a place to start and hopefully make a difference in how you're feeling and doing. And I don't know about you, because I do get a lot of patients just dipping their toe over into my side of the fence. I get a ton of people coming in on proton pump inhibitors and the nutritional deficiencies associated with that. And so when I talk also with them about doing cognitive decline and the microbiome, I know this particular article is more about cognitive decline, but there are several in there about proton pump inhibitors changing our microbiome. And I really, you know, the why is a PPI associated with dementia? It may be the B12 deficiencies and other nutrients that happen. It may be the change in the microbiome. We're not 100% sure yet, but it does make sense if I can look at your GI effects test and we are able to fix the reason why you need this proton pump inhibitor and we get you off it, we're definitely going to impact your health going forward in a cognitive way. So multiple sclerosis is another one. There's great articles out there, and this is 2017, that, you know, if we want to, we can pull out and use with our patients. Some of these I actually use with the gastroenterologist in my community. I've got 2 that are somewhat friendly with what we're doing, and then the rest of them kind of poo-poo the whole measuring the microbiome. But there's a specific one in town who says he doesn't know what type of religion I'm practicing, but it seems to work for a lot of people. So if I can have an article to kind of support and maybe lead those other providers into my side of the world, or at least open some windows that they look out and say, well, yeah, maybe there's something to this, I will. And this is a specific article that was used, I think, again, at IFM, that I pulled out and sent to one of my colleagues, because I have an MS patient who's definitely done better after we did the GI effects and worked on rebalancing the microbiome and things like that, and just to give him a little bit of the reason why. So I hope, because I don't think a lot of people think of cognitive issues and neurologic issues as a thing to start with the microbiome. I hope I've persuaded you for that. These next couple of case studies should really help put it together as why I start here with so many different types of patients. So this guy was a practicing general dentist. He still is. And he had fatigue, and his wife has been a patient for 4 or 5 years, and she persuaded him to come and see us. And he had had a full workup by his doctor, and who told him he was just depressed and wanted to give him Zoloft. And I think that was the final straw that really brought him over to seeing me. And he came in, he was pretty ticked off that his doctor had said, we're not young bucks anymore, because his physician is probably at least a decade older than him. So he was sleeping pretty good, getting up once to urinate. He felt he ate pretty healthy, and it definitely wasn't like going out to Subway. He was bringing things from home. He had not really gained a whole lot of weight and was still forcing himself to work out with a trainer. He was sexually active 1 time a week, and he was hoping I could get his wife willing to participate more. But he said, he used to love to get out in the water and paddle and surf, and he's too tired. And on the weekends, he used to love to do carpentry, and now he's too tired. But he denied some of the things that we really look at in depression. So I agree that Zoloft wasn't actually the answer. He did bring some of the things from his primary that they had done a whole bunch of testing, and surprise, surprise, he came in on Dexilant and Flomax, and his wife had put him on fish oil and curcumin, and he had picked up a prostate blend. Now, none of those supplements were quality. They weren't the ones that she was trying to get him to take. They were our typical drugstore, buy one, get one free type of supplement. So a lot of people would have stepped back and said, whoa, a dentist who's tired, why aren't you looking at heavy metals first? And in my practice, we do look at them, but it's usually one of the last things we look at, because if you're fundamentally not healthy otherwise, doing chelation or chasing heavy metals doesn't always make the person better. So I like to start with the thing that I know can make the most impact. And I knew if I could get him off the Dexilant, at the least, we could fix some nutrient deficiencies and hopefully get his fatigue fixed a little bit that way. So he brought some labs from his primary. As you can see, he's not on testosterone replacement, nor does he really need to be. And the B12 at 282 wasn't even mentioned because it was still within the normal range. But if you keep up with the current research on B12, they're saying even people within the normal range up to 400, 450 can have subclinical neuropsych and cognitive issues. So the 282 is certainly low enough to contribute to some fatigue. like I said, the testing options were a lot, you know, and not that any of these are wrong. You could have maybe gone with any of them. But by starting with the microbiome, I feel like I put the person fundamentally in a better place to even look at the other tests. Because if the microbiome's not in a good place and I'm not absorbing and I'm still taking the protonics, putting somebody on a bunch of supplements doesn't always fix it. So this is his test. Like I said, wow, I write on there, and when they hand it out, he really had low abundance there, and as you can tell, the front page showed several imbalances. So in the middle, this is page 2. He was fine with digestive enzymes. He had elevated EPX and the fecal secretory IgA. So to me, that means qualifies as leaky gut. I think most people using this test would agree with that. He was just shocked by how much inflammation he had, because he really didn't think that his gut was that much of a problem. But when we look at his yard, he was just really low all the way down, including lactobacillus species and bifidobacterium species. The Akkermansia on the bottom, there's some recent research that is associated with fiber intake, and that the more fiber you eat, the more this will grow, and it actually is associated with weight loss. So that's pulling over some of my obesity medicine. But I use that kind of as a discernment. Is the person eating enough fiber in their diet? And obviously, he wasn't eating hardly any. And when we talked, he said, well, I have a salad for dinner every day. And talking about the salad, it was romaine or iceberg, and it really didn't have a whole lot of fiber components in the diet. And then we look at the next page. Not surprisingly, no growth of the lactobacillus and bifidobacterium. And he was very aware that lactobacillus was a healthy bacteria that he was supposed to have in there. He was just shocked that he didn't have any. Looking down on the next category, the strep, he was like, well, everybody should have strep. That's what lives in the mouth. And I said, absolutely, and we talked a little bit about the link between dental oral health and this, and they're actually doing some pretty cool research on their end. It would be nice maybe down the road to be able to check the microbiome that lives in the mouth. And then he was colonized with 2 of the yeasts. And I don't know if your part of the country, you guys see very much of the rhodotorula. We see it a lot over here in Florida because it's that pink slime mold that likes to grow in showers and places, especially plastics. And so when I mentioned it was the pink mold, he just was stunned because he has an RV and they constantly have that pink stuff growing in the bathroom there, and he just could not believe that it was actually growing in him as well. So part of this comes down to knowing the patient. And with this guy as a dentist, he was definitely more traditional. If I had started and even jumped on the heavy metals thing, I think he would have ran. And but when we talked about the PPIs, when I showed him the risk associated with dementia, when I talked to him about the B12, he was all on board for checking. And then when we talked about the options, fundamentally the bacteria in us eat what we eat, and you can shift the microbiome simply by changing diet. But sometimes they're not so willing, or they want a quicker fix. So let me look, did I put, yeah. So with Fred, we fiber, and fermented foods. And we started avoiding the simple carbs that feeded the yeast. We used a slow wean off the PPI. I don't know if you know that if you stop a proton pump inhibitor too quickly, you will get a rebound hyperacidity. It really has to be, I don't think I've ever done it in less than 8 weeks. I've had some patients do it in less than 8 weeks because once they know the risk, they do the cold turkey thing and they suffer for it. But mastic gum is an awesome addition. It's the resin from a pistachio tree. It's not actually gum that you chew. And there's several vendors out there that take it, but it binds the acid in the stomach. So it really helps with the wean off the PPI. His wife was more than happy to stick him with the B12 shot and get the levels up. And we repleted some of the nutrients that were known to be depleted with the PPI. I use GI Revive a lot. It simply has almost everything in it that is known to help heal and balance the inflammation in the gut. It's multi-ingredient though, so if you have somebody with a lot of sensitivities, it might not be where you start because then you have no idea what thing might have flared their sensitivities. We used Ultraflora IB and Ultraflora Spectrum. Those are both Metagenics probiotics. And the digestive enzymes, he really wasn't that low. I felt like once he got some good bacteria growing in there and had a yard. I use the yard a lot as my example. For Fred, I would have said, you're driving down the street and there's this house that's got a bunch of weeds growing and there's no grass at all and lots of dirt patches and it just looks like nobody's taking care of it in a very long time. That's you know. So once we get the grass growing and we get a yard that looks good, I didn't think he would need the digestive enzymes after that. Oops, let me stay there. So it absolutely worked. I just saw him, I think, within a few weeks of turning the slide deck in. It's been a couple years, I think, since we did the gut test. And we went on from here and we did the GI NutriVal, the Genova NutriVal to look at nutrient deficiencies. We talk about the fact that he probably has the heavy metals and he just is, I feel great, and he's back surfing. He's actually taking up a new type of surfing that's popular here is paddleboarding, stand-up paddleboarding, but we're also, some of the people are putting little sails on the front of it. So he's doing that. He looks and feels a lot younger than his stated age. Tells me he puts most guys in his age group in the dust. He's taken up tennis. He's playing twice a week. So he's really, really doing well. I'm sure he has other things that we could go after and work on. But if I pushed him on it, I'd probably lose him as a patient. So you have to know where your patient is and kind of meet them there. And over time, if he starts having some symptoms or being not so well, he's going to be a lot more amenable to doing more tests. So case number 2 is one of my favorites. She was 20 when I got to meet her, and in about 14, 15, she was diagnosed with linea morphea, which is a form of autoimmune disease where the skin on the body gets tight and shrinks, and the underlying tissues do too. So when I met her, her one leg was a little bit what you would call in old-fashioned terms withered. In pants, you really couldn't tell. You would think that probably she had some mild cerebral palsy, but when she would wear shorts or a dress, you could definitely see the brownish, reddish tissue changes going down her leg. She had a little bit on her back and flank and a little bit on her arm. She had, being a kid, of course, and she grew up down in South Florida, she followed at University of Miami, and had actually, her dad had not been happy with how fast the disease was progressing. He took her to Johns Hopkins. She'd been to several different centers. She had been on several different biologics and had horrible side effects, none of them for more than a couple months. And by the time I met her, She hadn't taken anything for 2 years. She went away to college and refused to take any of those medicines. They all made her feel terrible, and she had done a lot of research on her own and had gone to a chiropractor, and we don't have licensed naturopaths, but kind of a holistic nutrition, naturopathic philosophy person up at University of Florida, Gainesville, and really wanted to try an alternative approach. Her parents were divorced, and her dad was in favor of her trying this alternative approach, but they needed an MD to see her to make mom happy. So that's how, even though she lived in Miami and went to school in Gainesville, she ended up in my practice, which was kind of somewhere in the middle. So we started out with her doing the gut test, and I didn't have to persuade her. She came in wanting to do the GI test. And when we went through it, her inflammation was high, her butyrate was very low, her beta-glucuronidase was borderline low. Beta-glucuronidase high, we often think about it with cancers and recycling our toxins, but low, it can also impact our ability to absorb some of our nutrients. And then when we looked at her yard, Prevotella has some recent research about linking it to autoimmune disease, recent being like the last 5 years. The De Silvio Piger down in the middle, I guess bottom third, also has a little bit of research. So looking at this, I felt like, I could identify a couple of things being out of balance that we would want to bring down, like those two categories. But if you looked at her additional things that were growing, she just had a very abundant garden, including some things that they're not labeled as pathogenic, but they're not necessarily friendly either. The Pseudomonas and Klebsiella and Citrobacter, I just have to presume or assume that one of the reasons she was picking up all of these things was because she's been in all these tertiary centers. Although now Klebsiella, we see it so often that it has to be in the walking well. And Lactobacillus, we had no growth, and she was 1+ positive for yeast. So, let me stay there. So Gina is very natural. She didn't want to take any pharmaceutical drugs. So we did some of the herbal blends that were known to help with yeast. We did some of the, I kind of call it, sometimes when you use the herbs, it's a little bit more like Roundup because it takes down some of the things we want to be there. But we use the herbal blends. I'm trying to think. Designs for Health had one that we used, and she also had one from the chiropractor, which I don't remember the brand. We did use the GI Revive. We had her tweak her diet. She was doing well with bringing in fiber and stuff, but she was eating the gluten. She was drinking the dairy, which are known to help instigate autoimmune in our side of the world. So 2 years later, we also uncovered and worked on a couple of other things along the way. Did the HLA typing for celiac for her when it came out and was available, and she was positive on the DQ2 side. And then when we redid the test a couple years later, there's like no inflammation. She's actually gone to where she's got an overabundance a little bit. And if you see, the inflammation was all gone. Beta-glucuronidase went lower. So that's one of the things we were addressing this time. But look at how nice the butyrate came up by adding prebiotics and probiotics into her system. And when we look here, she still had a lot of Prevotella. So we really didn't hit that as hard as we wanted to. And at this point in time, she's done even more research, and she wants to go ahead and maybe take a pharmaceutical to get rid of it. We went back and forth. I gave her the prescription. She didn't actually take it. But if you look on the third page here, again, beautiful change from last time to this time. And this time the yeast was labeled as candida, so she kind of zeroed in on that, and we worked on, again, the herbals. Candibactin, I think, is one of the things we use for metagenics, and working with the chiropractor up in Gainesville to work on the yeast. So the long and the short of it is she's 24, 25 now. And again, the reason I picked her, I just saw her in follow-up right before these slides were due. And her rheumatologist down at the University of Miami discharged her. He says he's never discharged anybody before, but she's had quiescent, no progression of her disease at all in the last 5 years. And she started to go to nursing school and has changed her mind. She's now attending the Institute of Integrative Nutrition, and she wants to get out there and help other people like her who don't want to take all those biologics, and work on balancing their leaky gut and their nutrition to make a difference. And so I love her. She's one. I told her when she's done, if she wants to move to Melbourne, Florida, we would love to have her here. So case number 3 is a 55-year-old woman. She had been a long patient for a long time. The first time I saw her, first time she came as a patient, was in 2005. She had been diagnosed celiac when she was a child and was eating it because she had no symptoms. So she comes to me diagnosed with MS, and guess what? Surprise, we take her off the gluten and everything resolves. She also had a positive celiac panel, just the blood tests for celiac at that time. So the funny thing is, she had been diagnosed as a child. She had no symptoms eating it. But before she went back to eating it, she had seen a primary care who told her that celiac was way overdiagnosed and ran a celiac panel, which was negative. Now remember, she's not eaten this stuff for 20 some years or 30. And so it's not surprising that the typical celiac panel was negative. So she took that as carte blanche to start eating that. And that was probably about 2002. And so in 2005, when she was diagnosed with MS, she came to me. And so the lesions got better, and I saw her off and on for a couple of years, and she's one of those that when something happens and percolates, she comes in and then everything's good and I don't see her for a while. But in 2014, she was diagnosed with breast cancer, and she had gone back to eating gluten. And I really, I'm like, why? And she's like, well, I wasn't having any symptoms, and I figured, we cured the MS, and so I wasn't that worried, and I figured if I had any of those symptoms, I'd go back off it, and we weren't really sure that it was the gluten that caused the MS, because other people with MS, their lesions go away too. So she was a little bit in denial. But she also now, when we drew the blood work, she also had Hashimoto's, which she hadn't had before in 2014. And she is a very sophisticated but living in denial type of patient. So she came in with the diagnosis of breast cancer, having done a ton of reading and research, and she was sure that she had leaky gut, and that was part of why she got the breast cancer. And so these are the first GI effects after the diagnosis with breast cancer. And obviously eating the wheat with the presence of an autoimmune disorder towards the wheat really caused some imbalances. So I told her, I'm driving down the street, looking at the yard, you've got nothing, nothing growing. When we look at even E. coli, nothing here. It's like unheard of. Good news was she didn't have yeast. The bad news was, going back, she was high on all 3 markers for inflammation. So guess what? The first recommendation was to get back off the gluten. We hit her hard with a lot of probiotics. Again, she started the GI Revive, and she's probably one of the first patients that made me aware that I really needed insensitive people to start single agent because the GI Revive made her really sick. And so we started out with just aloe and then adding some zinc carnosine and adding each thing separately and slowly to get that inflammation down. And so 1 year later, I don't even think it was quite a year, maybe 8 months later, she had finished radiation, she was through her treatment, we did the gut test again, and we get a completely different picture. We now have a yard growing, you know, and and we also use some of the soil-based probiotics with her because of how nothing was there. And we had really good responses here. She'd not been eating well. The radiation and stuff had made her very, very sick. And tired. So again, Akkermansia and fibers linked there from my obesity boards. And so we talked about increasing the fiber and using legumes and nuts and seeds and things like that, and continuing to avoid the gluten. She had good growth with the probiotics and stuff now of the lactobacillus and the bifidobacter and the E. coli. She picked up Klebsiella and Proteus along the way. I really think, you know, your immune system gets definitely compromised going through radiation, plus the being in those places where the sick people are makes it more likely to pick it up. The yeast is gone. I thought I had a third one in here from her. So I just saw her again, and another stool test, and it's remarkably beautiful. Now, all along the way, she had been reading the blogs, and she was taking calcium D-glucarate because everything she read about natural treatments for breast cancer recommended calcium D-glucarate. But she was never elevated on her beta-glucuronidase. So I would tell her, you don't need to take the calcium D-glucarate, your beta-glucuronidase is fine. And each time we tested, it dropped lower and lower. Now, I know the calcium D-glucarate doesn't get rid of it. It just binds the beta-glucuronidase, or acts as a decoy, actually. But at this point in time, I was encouraging her to eat some things that would help foster those bacteria that make that. That's more our E. coli and our lactobacillus. She's staying on probiotics. She's not had any reoccurrence. The funny thing is she's also positive for factor V Leiden, as well as MTHFR, as well as celiac. I mean, she really got dealt a not so fun hand of cards. So she's not a candidate for tamoxifen or any of those things, which just drives the oncologist crazy. So I think that kind of wraps up the 3 cases of different types of patients really to look at it for. I don't know if those of you out there have a lot of patients with true diagnosed celiac disease from childhood. I have a handful, but it's just remarkable that a lot of them will still eat the wheat and end up with other things. I have one that went blind after eating gluten for about 10 years, and they told her it was gluten associated down at University of Miami's school. Bascom Palmer is probably the #1 eye institute in the country. So it's definitely can do more than just upset the stomach. And I've seen it in my practice.
Feel free to contact client services with additional questions. You will see a contact number on the slide for US and UK customer service. Additionally, please call client services if you need assistance setting up a MyGDX account. We also offer complimentary appointments with our medical education specialists to answer questions related to our testing, including choosing the right test and reviewing patient test results. Finally, we'd like to encourage you to register for our upcoming webinar on gdx.net website. Next month, we will have Dr. Thomas G. Williams presenting on supporting gut barrier function. Thanks again, Dr. Hunton. That was an excellent, rich, great presentation.
Thank you.